Bonjour Yannick, bonjour à tous. Jagdish Joypal, bonjour.
Bonjour Nawaz, Yanis, bonjour, auditeurs et internautes, bonjour également.
Reprise des travaux parlementaires ce matin, la private notice question du leader de l'opposition, Zavélix Duval, axée sur la mort de 11 patients dialysés qui sont donc décédés pendant la deuxième vague de Covid-19. Comment je te connais, tu as l'enquête qui s'y fait, d'abord un fact-finding committee et puis tu as donc le comité qui est présidé par le donc Rajnak Shetty, le Medical Negligence Standing Committee, qui constate de graves manquements dans donc le cas de ce patient-là. Il y a 80 patients qui sont admis dans l'hôtel Tamassa et 11 qui ont perdu la vie entre le 20 mars et le 19 avril 2021. Et là, Jack DJ Paul, ce rapport, tu n'est gardé secret. Donc, si la presse partit pour sortir avec ça, donc tu as nos confrères de week-end et nous-mêmes, Radio Plus, fin sortir avec quelques extraits du rapport, eh bien, le grand public et surtout les patients, les familles des patients décédés, les familles des victimes, partis pour connaître qui fin arrivé. Le rapport est assez damning pour surtout donc le management de l'hôpital de Souillac et aussi pour le personnel de la santé parce que, par exemple, il dit qu'il y a un patient qui trouve l'amour par eux-mêmes, pas qu'il aucune assistance, aucun soin. Ce n'est que le matin, quand le personnel peut donner dité, qu'ils se trouvaient qu'il y a des gens qui perdu la vie. Et là, sans doute, vous avez Luc Duval pour situer les responsabilités et pour demander au ministre Diagatpal qu'il y ait une mesure qu'il prend à la lumière de ce rapport.
Oui, il y a d'abord les bons qui sont auditeurs et internautes connaissent deux rapports. Un premier rapport, un fact-finding committee qui est présidé par ancienne juge de la Cour suprême, Madame Deviani Bissundeyal, donc qui pas fait de rendre public. Et là, le deuxième rapport dont nous pouvons faire état, et c'est le rapport du Medical Negligence Standing Committee. Et Xavier Duval peut dire au ministre de la Santé, Kailesh Jagatpal, c'est les bonnes mesures qui finissent prendre par le ministère de la Santé concernant ban cas, côte finit la négligence, côte finit la grave manquement et omission. Et Xavier Duval peut demander également s'il y a une copie, sa section concernant le rapport côte ban dialysé inmo, il y a 11 cas, 11 victimes. Alors si sa copie, s'il y a une partie de ce rapport-là, il soumet et il envoyé, il adressé à ban proche de sa ban patient décédé là. Alors donc ces ban li concerne comment nous dire la mort 11 dialysés qui t'y admettent en quarantaine entre mars et avril 2021. Certains dans l'hôtel Tamassa à Bellom, ils trouvent un mort comment Nawaz fait dire atroce, abandonné aux autres même et c'est le lendemain matin après qu'il se fin décédé qui employait l'hôtel quand il amène petit déjeuner qui découvert je fin décédé et ça lui concerne 4 cas spécifiques sur les 11 concernés. Alors, le Medical Negligence Standing Committee, il fait état de serious failures and omissions, c'est-à-dire défaillances et lacunes qui finissent constatées pendant sa période de la pandémie. Alors, administration l'hôpital blâmé, surtout l'hôpital de Souillac, et certains patients, donc, en fin mort, dans une condition atroce, parents, ils ont une difficulté pour capable pas fin récupérer même les corps, je fin donc être transféré directement au cimetière. Alors certains de mes patients qui t'y admettent en quarantaine d'ailleurs, pas testé positif et il paraît qu'il deux parmi ça 4 qui finissent décédés dans une condition difficile là, je pas tiens la Covid. Voilà la situation donc comment il était. Mais Nawaz nous besoin reconnaître qu'il dans le monde, il y a beaucoup de difficultés. Aucun établissement hôtelier pas fin bien préparé, pas fin un plan d'urgence. Donc au jour le jour, fin besoin gère la situation de Covid et l'hôpital de Souillac qui dépassé, débordé, fermé, patients dialysés, qui besoin même donc transféré de là-bas, c'est qui expliqué, je pas fin gain soin de dialyse pendant la période de la pandémie.
Voilà, donc la séance a déjà débuté.
2023. Letter dated 16 June 2023 from Honorable Nakchedi to the effect that while she was intervening on the second reading of the appropriation bill at the sitting of Wednesday, 7th June, Honorable Armance uttered the word joker to his address. In fact, following a point of order then raised by Honorable Nakchedi, I had requested Honorable Armance to withdraw the said word. Honorable Armance denied having uttered the word and further requested me to verify from the recording. Honorable members, I have checked the answer, and I can now confirm that Honorable Armance did utter the word joker. I am now inviting Honorable Armance to withdraw the said word and present apologies to the House. Thank you.
Mr. Speaker, can you please let me know which word it is? I won't hear you well.
The word joker, I already said the word joker.
Yeah, I didn't say the word joker. I said it was a joke.
The word joker.
I didn't say the word joker. I maintain it. Okay, I'll apologize.
So are you withdrawing or not withdrawing?
I withdraw and apologize.
And apologize to the House because
you.
it caused me to go and verify. You have to apologize to the House.
Papers have been laid. Questions?
Leader of the Opposition.
I have my question, Mr. Speaker, is addressed to the Honourable Minister of Health and Wellness. Whether in regard to the death of the 11 dialysis patients out of the 80 quarantine patients at Tamasa Hotel during the period 29th March to 19th April, he will state, A, the actions taken by his ministry with regard to cases where the Medical Negligence Standing Committee has found serious failures and omissions, if any, and B, if a copy of the relevant sections of the report of the Medical Negligence Standing Committee has been sent to the late patient's next of kin.
Mr. Speaker, sir, I welcome the PNQ from the Honourable Leader of the Opposition, which allows me the opportunity to inform the House and the population where matters stand in this regard. Over the past few weeks, comments have been made regarding the issue of dialysis patients who unfortunately passed away during the onset of the second wave of the COVID-19 pandemic as from March 2021. In fact, Mr. Speaker, sir, to protect the population against the deadly coronavirus at a time when the vaccination program has just started, there was no other alternative than to quarantine persons who had been in contact with COVID-19 positive cases. Had we not resorted to quarantine at that point of time, we would have witnessed hundreds of deaths among dialysis patients, among cancer patients, hundreds of deaths among frontliners, and thousands of deaths among people with comorbidities and the elderly. Mr. Speaker, sir, contrary to what the opposition has been continuously insinuating, the House will recall that the WHO and World Bank had commended Mauritius for this life-saving initiative. At that particular time, Mr. Speaker, sir, when the Honourable Prime Minister and members of this side of the House were encouraging the population to get vaccinated against COVID-19, the Leader of the Opposition, along with other members of the opposition, were levelling criticisms against consent forms and COVID-19 vaccines. Allow me, Mr. Speaker, sir, to elaborate on the context under which all necessary measures had to be taken to transfer non-positive dialysis patients to Tamasa Hotel. In March 2021, 407 COVID-19 positive cases were registered in Mauritius, and the epicenter of the infection was in the south of the island. On March 25, 2021, a nursing officer posted at the dialysis unit at the Suyak Hospital was detected COVID-19 positive. Contact tracing was immediately carried out among all the staff and the dialysis patients who were in contact with the nursing staff. In line with quarantine and contact tracing protocol, Ministry had to take immediate actions to protect the lives and well-being of the dialysis patients, since these patients were already vulnerable, being immunocompromised, and almost all of them were not vaccinated against COVID-19, in spite of having been repeatedly offered to be vaccinated. Mr. Speaker, sir, in real time, my ministry had to mobilize all resources human and logistics, so that to be able to transfer dialysis patients who were not COVID-19 positive to an appropriate facility which was in the vicinity of the dialysis center and was readily available at that time. Side by side, arrangements were made at the New York Hospital to isolate the COVID-19 positive dialysis patients. In March 2021, 86 dialysis patients were transferred to Tamasa Hotel under the care of the health personnel, including 2 medical and health officers, 2 nursing officers, and dialysis nursing staff. It is to be highlighted that all the dialysis patients at Tamasa quarantine facility had to undergo dialysis thrice weekly at the Suyak Hospital, and Ministry had to deploy all the logistic and facilities to transfer these patients for their treatment. At that point in time, we on this side of the house were constantly encouraging the frontliners, while on the other side of the house, they were constantly pointing fingers at the professionalism of our frontliners. It was very challenging indeed at that same time to run the normal health services, to engage in contact tracing, to quarantine hundreds of contact cases on a daily basis, to conduct domiciliary COVID-19 tests, to provide treatment to COVID-19 patients, and at the same time to roll out the COVID-19 vaccination campaign, and also when there was a red zone in that region. This is not only challenging, but also a daunting task. Mr. Speaker, so in regard to Part B of the question, prior to June 2022, outstanding cases of alleged medical negligence for inquiry at the Ministry stood at 45 and dated back to 2017. In order to expedite matters, Ministry constituted the Medical Negligence Standing Committee in June 2020 as an independent body following the constitution of the Medical Negligence Standing Committee. The latter investigates into cases of alleged medical negligence, which has been referred to it by the Ministry. The Medical Negligence Standing Committee, chaired by a barrister, submits its report on preliminary investigations to my Ministry in case of alleged medical negligence. My Ministry refers the case to the regulatory authority concerned, be it the medical, dental, or nursing council. If there is no suspected case of medical negligence, the Medical Negligence Standing Committee informs the patients or the late patient's next of kin of the outcome of the investigation. Mr. Speaker, sir, I wish to inform the House that my Ministry referred the 11 cases of dialysis patients who passed away between the period 29th March to 19th April to the Medical Negligence Standing Committee on 30th March 2022 to carry out an investigation on the treatment and management of the late 11 dialysis patients. Among these 11 patients, 2 were quarantined at Tamasa Hotel and 9 at the New Suyak Hospital. In this respect, a meeting chaired by the chairperson of the Medical Negligence Standing Committee was held on Friday, 22nd April 2022, with the relative of the deceased. Mr. Speaker, sir, besides the parents and close relatives, the MNSC interviewed doctors, nursing personnel, paramedical staff, attendants, among others, posted at Tamasa Quarantine Center, New Suyak Hospital, in order to gather as much information as possible. Upon the completion of inquiries, the Medical Negligence Standing Committee submitted 11 individual reports to the Ministry in February 2023 as follows. Case number 1, patient had not been provided with appropriate medical care and attention, ensuring while in quarantine at Tamasa Center, while in the isolation ward at Suyak Hospital. Case number 2, this committee is unable to attribute medical negligence on the part of the attending personnel. Case number 3, it is an undeniable fact that the late patient was made to undergo certain uncomfortable moments while being conveyed to and isolated at Tamasa Center. Lack of communication was distressful to patient family. Case number 4, in spite of staffing and other constraints, the patient was clinically well managed at New Suyak Hospital and there is no issue of any medical negligence. Number 5, it is a fact that patient did not obtain the required medical and nursing care while he was admitted at Suyak Hospital. The complaint of this patient is fully justified. The patient, the case number 6, the patient was properly managed and treated as per the existing protocol. The committee, the case number 7, the committee cannot find per se any issue of medical negligence with regard to the late patient. Case number 8, the patient had been in the circumstances clinically well managed at Suyac Hospital and all investigations, including imaging, were carried out on time. Case number 9, it is noted that patient's complaint regarding his fever and symptoms were completely ignored at Suyac Hospital, and the staff did not comply with the existing COVID-19 protocol, and the patient had to endure several transfers between health facilities. Case number 10, the committee noted lack of adequate staff and logistic support. Case number 11, the poor transport facilities and appropriate setup for healthcare at quarantine center. However, there appears to be no other evidence of any shortcomings in the clinical management of the patient at Suyac Hospital. My ministry took cognizance of the report and noted that MNSA did not make any specific reference of negligence to any officer in particular in the 11 cases of alleged medical negligence. It is understood that the MNSA, in light of the unprecedented event, could not specifically pinpoint any person being negligent. In this circumstance, the ministry has deemed it necessary to refer the case to the medical council and nursing council for further investigation. Given the inquiry is still going on, ministry cannot share any information about the parties in order to jeopardize the outcome of the inquiry. In March 2023, the 11 families of the patients were informed by way of letter about the outcome of inquiry. 2 cases, the family were informed that the matter has been referred to the Medical and Nursing Council. The other 9 cases, the Medical Council of Mauritius requested that these cases be referred for investigations. In conclusion, Mr. Speaker, sir, the third part of the question being that the cases are still being investigated by the Medical Council of Mauritius, so it is not deemed fit to give the information, to provide the information to the public. So in conclusion, I wish to point out, to reassure the House, that Ministry has always acted in good faith and in best interest of all patients. Ministry is committed to bring continual improvement in our healthcare system. Thank you, Mr. Speaker.
Mr. Speaker, the whole country knows that his failure to pre-order vaccines, which he qualified as stupid, was the cause of many, many deaths in the early stages. So I take no lessons from him. Mr. Speaker, I'd like to ask Honourable Minister, on the 9th of May in this House, he informed this House that there were only 2 cases of negligence, and this is what I quote what he said: the remaining cases were devoid of any negligence. Now he has selectively quoted, supposedly from some reports of the 11 reports. Why does he still maintain, therefore, that in the face of what the actual report says, that he misinformed the House in saying that the other cases, the remaining cases, apart from the 2, were devoid of any negligence, not medical negligence, any negligence, full stop?
Mr. Speaker, sir, I'll first come back to the first part of the order of vaccination. I would remind him that order of vaccination has been taken place since 2020, and where the same leader of the opposition has been opposing. I think I've been answering to your PNQs many times. We won't go that. Let's specifically come to this part of the question. Yes, Mr. Speaker, sir, I maintain in what I've said, where the Medical Negligence Standing Committee has stated clearly that there is an act of medical negligence. These cases have been referred to Medical Council and to other authorities for further investigation. In other cases, as I have pointed out in my reply, there has been shortcomings in terms of transport, in terms of other facilities, which as in my introduction, I've pointed out how it was difficult at that point of time for frontliners to work. It was not, the normal situation that we were working. Can you imagine within 24 hours we have to transfer 86 patients to quarantine or hospital? And in that context, in those circumstances, how difficult it is to manage the transport, everything concerning dialysis patients? I agree. There were some kind of shortcomings in probably communication or transport facilities. Totally agree. We were not perfect. That was not the situation only at Suyak Hospital. That was a worldwide situation. And if you'll see the international report of other countries, I should not mention over here, I don't want to defend what has already been said and done, but it was a very tight situation that we had to manage with our resources. What have they been doing during that time? Only blaming the frontliners for not being working. Have you ever encouraged? Shame on you. Shame on you.
Order! Honorable Leader of the Opposition, withdraw that word. This is not polite at all.
I withdraw it.
This is not polite at all.
I didn't want to be polite. I didn't want to be polite.
Now, this is sufficient. The minister is replying, you can't introduce words which are unparliamentary. This is my ruling. Full stop.
Yes, Mr. Speaker, so I'll continue. So I recognize the situation was very difficult, and it was not easy to get staff to work on a daily basis. That was not a normal situation. With that, I agree with the report. Where the reports has been clearly stated that these cases have medical negligence, they have been referred to the authorities, while the other cases were not referred. But because of them, because of their attitude, giving, I don't know what kind of information to the press and what the press has been reported, the Medical Council has requested that all the cases be referred, and also there is interconnection between other cases because it is the same nursing health professional doing the cases to the other cases that have not been referred. So that is the reply to what the Honorable Leader of Opposition want to know.
In the light of what the report says, there were serious failures and omissions with regard to the care and management. Management is you. Management of several cases, including 4-5 names that he gives, instances of neglect and poor treatment. Why did he say a few weeks ago in this House that the other 2 remaining cases were devoid of any negligence, which is clearly against what here is said in terms of neglect of these patients? Why did he say devoid of any negligence?
Mr. Speaker, sir?
Except 2 cases.
That's why the cases where it has been clear, what you said, Honorable Leader of Opposition, you are totally right. Where there is serious omissions and devoid, improper management, these cases have been referred. But where other cases haven't been referred because it didn't state these clear, what he said, serious omission or poor management. That's totally correct what you said, but we are very specific about the cases.
Mr. Speaker, the report talks about disastrous transport facilities. Whose fault was that but the ministry? It talks about inappropriate food, people being given biryani and fried rice. It talks about non-existent medical monitoring. 2 people were found dead in the rooms in the morning after dialysis. It talks about medical records not being kept or destroyed. These, Mr. Speaker, are either medical shortcomings or administrative failure, and I understand why the minister does not want to publish this report, because he is the person who is blamed in this report.
Put your question.
Is he refusing to publish the report because he knows full well that he is the person blamed in this report?
Thank you, Mr. Speaker, sir, to give me the time to give all what he said. First, he pointed out of disastrous transport. Mr. Speaker, sir, he doesn't know the reality. He has never visited one patient who has been in a dialysis center. He doesn't know how these transport patients from their house to the hospital. Mr. Speaker, sir, at one point of time, there are some 20 dialysis machines. And you have to conduct these dialysis, 20 dialysis patients have to be there, and then for another batch after 3 hours to conduct for another 20 or 15 patients. Do you think, is it possible for each and every patient at that point of time, during that period of time, even now it is not possible, to convey each and every patient separately with a staff, with somebody to carry them to the hospital? It is not possible. The patients have to be carried in one transport. Yes, at that time, in normal time, we carry more than 10 patients in a transport, but at that time there were 5 patients. Who would know that one patient will be tested positive at a later stage? No one will know. But we have to accommodate with the existing facilities. I will leave it to all those who have managed the transport during the COVID-19. He's blaming the minister. I will first leave it to him. All those people who have managed the transport during COVID-19, for all these, whatever we've been doing for COVID-19, to them, whether they have disastrously managed the transport facilities. First thing. Now, second, he said also about the different reports. Let me tell you about the food, the biryani. When patients were offered food as per their requirement in the quarantine centers, the patient said, we prefer to have house food.
Order!
Food. They will prefer to have...
Order! If you continue, I will ask you to withdraw from the chamber. My wife, please, continue. Order! I'm not shouting, I'm stating my rule. My rule is, if you continue to disrupt, then you will be asked to withdraw from the chamber.
Mr. Speaker, sir. It happens, Mr. Speaker, sir. It happens whenever you get the right replies from the opposition. We are used to when you get excited or not. Yes, Mr. Speaker, sir, I will continue. So I'm taking the National Audit Report. A nutritionist was roped in to prepare the diet of the patient. The dialysis patient had special requirements, including meal before and after the dialysis. The patients also could not avail from food from their home. Therefore, special arrangements were made, and so on. But yet, Mr. Speaker, sir, if patients need, that's where the complaint came from, that these patients say that the food was not proper. In fact, the food was tailored to their need. But what happened is, in majority of cases, that is what concerning the food, whatever he has been saying. Now, the third is about the medical report. Yes, that was a situation that we had to manage with limited staff. At one point of time, I got questions from the opposition that there was a nursing staff. Even the PAC report made reference to one nursing staff being working for many days, for many weeks, because we were in a situation that whoever been working in a quarantine centers had to be quarantined 2 weeks. Is it possible for us to get that number of staff to work in quarantine centers? We were limited in our resources. I agree with that. But we acted faithfully, and we devised all means how we will be able at the same time to look after anyone being admitted in quarantine centers, and at the same time manage how to protect the lives of these frontliners, because they have to go 2 weeks again into quarantine. So that was the situation. And what the leader of opposition wanted to point out, that it is the minister's fault. Mr. Speaker, sir, he has been in government, he knows how to run a public service. In that public service, at every stage you have a supervisor. You are in a ward, you have the ward manager. With the ward manager, you have the nursing supervisor. With the nursing supervisor, nursing administrator, coming up to the director. After the director, this is a regional director. You come up to the administrative staff. The ministry devises the policies, and this has to be, the policies have to be translated into implementation plans by hospital or doctors. It's just like if tomorrow we got somebody who has a medical negligence complaint, so the minister is responsible. Minister was involved in doing the operation. You've got to ask proper question, Mr. Leader of the Opposition, Honorable Leader of the Opposition. Please don't make politics on death of people.
This is clearly a cover-up to hide their incompetence. This is what the report says on the ministry. And this is 1 year after the start of COVID. This is March 2021, Speaker. Here it says there is absence of planning by those at the management level. Absence of planning. The standard of medical care and nursing care was grossly inadequate. Absence of planning, I mentioned. Serious failures and omissions. And he gives the names of the people who died for that. In fact, Mr. Speaker, out of the 11 cases of deaths in that period, 10 are either medical failure or administrative failure. And this is what I'm going to ask the minister now. He has in the past said that he will give financial compensation. He will think of giving financial compensation. He said so recently, and he says so also 2022, if there were failures and omissions found. Now this is the case. I'm going to ask him. Many of these people died in horrendous conditions. Many of them were breadwinners, 50 years old and younger. And many of them, all of them, were loved and cared for by their family. They were forcibly taken from their house. They were forcibly taken from the house and brought to Tamasa Hotel. Therefore, accept your responsibility. Accept to give. Will he accept to give?
Leader of the Opposition, listen. Yes. You're making a long statement. Time is running. Yes. You have only a few minutes. Yes. Put your question.
Will he accept to give financial compensation? And will he release a report to the families concerned, given that last 2 weeks ago in this House, he said there were two reasons. One, those cases.
No. You asked a question already. You asked a question already.
I did, yes.
Don't let you in, please.
Mr. Speaker, sir, Honorable Leader of Opposition, you have asked me 5 questions. Now give you time to reply to all your questions. You first made your...
Order. Order.
Mr. Not run away.
Order.
Run away.
Order, if not you're going to withdraw from the chamber. Please.
Mr. Speaker, sir. First part, he said management failures. Again, I'll inform him. The report said if there is failure of management, it should be at the hospital level, at the quarantine center level, and the report should point out who is responsible. That is how a report should be done. But because of those circumstances, the report also pointed out, because of COVID-19, unprecedented circumstances, it's very difficult to point out where at the management level, because everyone was working in a very restricted and difficult environment. That's why he has to give the report complete, if ever he has. I don't know. Now, second said, he said about compensation. I have to tell him that if an inquiry is still ongoing, how do you give compensation? He should know that whenever there is an inquiry on alleged medical negligence case, when case has been referred to proper authorities, after even that authority give their, the conclusion, conduct their report and submit their report, we still have to go for the medical tribunal. Up to you don't complete the whole set of all the investigations and the report will come up, this would be the definite report. Then how we have to, whether compensation, we have to meet for the compensation. And obviously, in cases where there is medical negligence or any other forms of negligence, the ministry will definitely act according to the compensation. Will do whatever be in the provision, whatever be the procedures, will act according to that. And now, Mr. Speaker, sir, he again stated that dialysis patients were forcibly put in quarantine. He should know that if we wouldn't have put all these patients in quarantine today, we would have recorded, what would be the death toll among dialysis and cancer patients. would be many, many folds more, maybe more than 100, Mr. Speaker, sir.
And their parents were not allowed to accompany them except in very few cases. That is the crime. Mr. Speaker, 2 weeks ago in this House, the Minister said that there were 2 reasons for not giving the report out to the families. One, that it was going to the Medical Council. We now know there are only 2 cases that he has sent to Medical Council in his reply here. So the 9 cases are not going to the Medical Council. The second thing is, Mr. Speaker, I am here tabling letters from 7 families asking me, giving me permission to request that the Minister give to them their report, the sections of the report dealing with the death of their loved ones, because they need to know how they died and they need to know whether or not to refer and ask for a judicial inquiry, which would be the proper thing to do.
Mr. Speaker, sir, first I'll come back to the 2 patients that we have referred to the Medical Council and the request of the Medical Council to refer all the 9 cases. Mr. Speaker, sir.
Order! What is this sort of behavior?
Exactly, that is the behavior. He has been so for the last 3 years. He has not changed and he will not, Mr. Speaker. Now, yes, for those 9 cases, so it means all the cases being investigated by the Medical Council. 1. And Medical Council is a body corporate who is mandated to invest into the cases. What do?
You finish?
La question.
Time is over.
La question.
Voilà donc pour cette private notice question consacrée à la mort de 11 patients dialysés qui t'y admettent soit en quarantaine à l'hôtel Tamassa ou bien dans l'hôpital Souillac durant la 2e vague de COVID-19. C'était en 2021, entre fin mars et mi-avril 2021. Alors, Xavier Duval, envie de connaître qui mène action, qui le ministère de la Santé finit prendre la lumière de un rapport qui finit gagner. Il y a d'abord le Fact-Finding Committee et puis il y a le Negligence Standing Committee qui est présidé par l'avocat Raji Nakchedi. Le ministre de la Santé, Khaled Jagatpal, finit dire qu'en général, lacune qui finit énumérée dans le rapport, des causes de manque de communication, manque d'assistance médicale, manque de staff, manque de facilités logistiques. Et d'après Khaled Jagatpal, le rapport n'est pas montré du doigt une personne en particulier. Il n'est pas cité nom de un staff qui, d'après lui, finit faire preuve de manquement. Donc, il blâme plutôt le système qui s'y met en place. Et Khaled Jagatpal dit qu'il maintenant, il y a un cas qui finit être référé au Medical and Nursing Council. Xavier Duval rappelle qu'en mai, quelques semaines de cela, Khaled Jagatpal lui-même dit qu'il y a des cas quand il trouve négligence médicale. Et maintenant, le rapport peut faire mention de 4 cas. Et maintenant, Khaled Jagatpal lui-même peut dire que le Medical Council fait une request pour enquête aux 9 cas. Alors, le leader d'opposition a envie de connaître which is which et il accuse le ministre Jagatpal d'avoir induit le Parlement en erreur quand il cause seulement de 2 cas en mai dernier. Et Xavier Duval rappelle à Khaled Jagatpal qu'il peut dire ça se roule là, qu'il y a 2 cas de négligence, et bien les autres cas-là, il n'y a aucune négligence tout court. Il n'est pas à cause de négligence médicale, il n'y a pas aucune négligence dans les autres cas, alors qu'ils ont dit peut trouver qu'il y a encore un cas et le Nursing Council lui-même peut request pour enquête le 9 cas. Et Xavier Duval pensait que c'est un cover-up pour casser l'incompétence du ministère de la Santé. C'est ce que le leader de l'opposition finit dire. Il finit aussi demander ce qui peut donner une compensation financière aux familles des victimes. Khaled Jagatpal dit qu'il y a une enquête qui est en cours, il faudrait attendre l'enquête finie, éventuellement référer un cas au Medical Tribunal et quand le tribunal rend son verdict, qui pour final, à ce moment, capable cause en termes de compensation financière. Jagdish. Alors, le point clé là-dedans, Jagdish, Xavier Duval rappelle la réponse du ministre en mai dernier, côté cause de 2 cas, et là, Zodi, il paraît à la lumière de ce rapport que la situation est plus grave que cela.
Oui, c'est à la lumière du rapport de Medical Negligence Standing Committee qui trouve une situation tout à fait différente de ce que le ministre a dit auparavant au Parlement. Alors là, il y a cette question, est-ce qu'il finit induire le Parlement en erreur ou bien il patina suffisamment d'informations à l'époque? Deuxième aspect, donc, quand Xavier Duval cause de cover-up, alors, et là, c'est une question qui concerne surtout une procédure parlementaire, côté ministre besoin être au courant du dossier et il vient, il expose exactement le fait et donc pas venir après, venir changer. La situation
Mais
change.
par exemple, la question de manque d'information ne se pose pas parce que le rapport du Negligence Standing Committee a été soumis au senior chief executive de la santé en janvier cette année-là.
Oui, et la déclaration, il fait bien après, au mois de mars, qui Xavier Duval au mois de mai, qui Xavier Duval peut mentionner. Donc, le ministre est déjà en présence, mais le rapport jamais fin communiqué. Certainement au ministre, oui, mais en public et aux membres du Parlement, pas finéna le contenu du rapport. Maintenant, cette question, elle concerne également les 86 pas 80, c'est 86 patients dialysés qui sont transférés dans un centre de quarantaine à Tamassa. Et là, il concerne 11 cas qui vraiment est en litige, nous pouvons dire, qui est directement concerné par le traitement qui se fait gagner. L'aspect important, on évoque l'inavoise, c'est qu'aucun officier du ministère de la Santé, pas single out, pas fin directement identifié comme il commet un cas de négligence. Ce qui donc permet au ministre de la Santé et à l'administration des hôpitaux de ne pas prendre des sanctions. Alors, parce qu'il peut une mention de faire. À moins si le Medical Council, qui peut étudier encore les cas, à l'identifier certaines choses, mais là, collectivement, comme si tout un employé finit concerné, avec un protocole, avec un plan d'urgence.
Mais le rapport blâme le management.
Le management de l'hôpital, surtout, et Xavier Duval peut dire qu'on blâme le management, c'est le ministre de la Santé qui assume les responsabilités. Et là, quand il est Jagatpal, il explique procédure qui est là concernant le management, comment il y a différents administrateurs, managers, donc différentes étapes qui concernaient dans l'exercice, dans le fonctionnement d'un ministère ou un département. Et donc, il confirmait qu'il finit la négligence. Dans deux cas, la question de compensation pouvait possiblement bien après, mais le ministre dit au cas où vraiment le Medical Tribunal trouvait finéna manquement et donc finéna, ça bonne personne décédée là, fin subir et comme si une certaine souffrance, donc il faut considérer la question de medical compensation, surtout à la lumière de procédures qui existaient au niveau du ministère de la Santé.
Et Xavier Duval fin brandi ben lettre qui ben famille fin envoyé et des pédiatres qui ben famille peut envie gagne le rapport, on veut une copie du rapport.
Mais dans cette famille qui finit écrire directement, il dépose sur la table du Parlement sa bonne copie de sa bonne lettre là pour dire qui va une famille concernée. Donc 7 cas de décès, une famille où les connaît, dans quelles conditions et ban proche in décédé et comment ça finit traité dans le rapport du comité.
Voilà, autant pour cette PNQ quelque peu agitée. Donc, il y a beaucoup d'émotions autour de la mort de ces 11 patients dialysés là. Donc là, en ce moment, c'est le Medical Council qui peut faire l'enquête et éventuellement pour référer le cas à Medical Tribunal. Pas connaître combien de temps ça peut prendre. De toute façon, maintenant, 2 ans
déjà
écoulés. Donc, une famille pas pour capable réclame dommages et intérêts à l'État. Mais si le tribunal trouvait qu'il finit la négligence, l'État est capable toujours compense financièrement les familles concernées.
Oui, et entre-temps, l'association des patients dialysés Papelas, la Papelas prise, elle peut maintenir la pression sur le ministère de la Santé, sur le ministre de la Santé aussi, dans le sens qui finit la négligence et donc The Ban Pros fin affecté. Là, nous pouvons suivre, nous étions un peu combien de temps encore ça peut continuer. Surtout, c'est un état de fait, un état de situation. Et le rapport, il n'est pas encore, il n'est pas officiel. Et
un extrait du rapport.
Un extrait de rapport qui est sorti.
Ouais.
Et donc, la presse,
mais pas démenti.
Mais pas démenti, et pas le ministre de la Santé.
Voilà, merci à ben auditeur, ben internaute qui finit de suivre cette séance, cette tranche des travaux parlementaires. Si vous avez envie de continuer les travaux parlementaires, branchez-vous la page Facebook de Défi Média. Merci, à bientôt.